morning. I think we'll start this morning with Marion, and then I'll do my update after that.
Thanks, Dr. Morrison. Good morning, everyone. The Health System Joint Response Team has been working closely with the Chief Public Health Office and the Department of Health and Wellness to align our services with changes to the travel restrictions announced yesterday. Health PEI has compiled a list of staff who've traveled within Atlantic Canada in the past 14 days, and these staff have been given direction to closely follow the public health guidelines, including the appropriate use of PPE, physical distancing, and monitoring for any symptoms of COVID-19. As announced yesterday, those staff working in long-term care are to self-isolate as they cannot work isolate, and we continue to work to keep our most vulnerable residents safe. Our surgical services and ambulatory services are also evaluating the list for non-urgent procedures. For people who have traveled outside of PEI within the past 7 days who are scheduled for non-urgent procedures, they will be called to discuss their procedure and possibly reschedule if necessary. This is being done to prevent COVID-19 from inadvertently re-entering our hospitals. The Joint Response Team has been planning for this wave of COVID-19 and how to respond over the past several months. We have thorough plans for how the health system will adjust should we see cases here, including a phased approach to changing services as needed to maintain a balance between providing the best care possible while limiting the spread of the virus. We are also revising our visiting protocols regularly. Our most recent version includes implementing restrictions on visitation, including a process to permit the compassionate visitors for only those coming to PEI from New Brunswick, Nova Scotia, and Newfoundland, as well as those from outside the Atlantic provinces. These visitors from within Atlantic Canada but outside of PEI will now follow the same process as visitors from other provinces in Canada have been doing while the Atlantic bubble is suspended. This includes a requirement to apply to the facility where your loved one is receiving care, as well as with public safety, to be allowed to enter PEI to visit. The process also requires testing prior to visiting and throughout their isolation period on PEI. A negative test is required before visits. I want to thank Islanders and our healthcare teams for their attention to all the public health guidance that's been going on and our ongoing measures that are now in place. I want to reiterate as well that now is the time for everyone, including our healthcare workers, to be extremely careful in our practices at work and in our social gatherings, paying close attention to physical distancing, hand hygiene, and mask wearing at all times. Please keep your circle of contacts small and follow the public health measures which are in place to keep us all safe. Thank you.
Thank you, Marion. So today there are no new cases of COVID-19 to report in PEI, and there is currently only one active case in the province. So this morning I'd like to briefly comment on the suspension of the Atlantic bubble, masks, holiday gatherings and travel, and the COVID-19 vaccine. In Canada, there have been almost 338,000 cases of COVID-19, which is a 30% increase from previous weeks in terms of the number of cases in the country. We've seen a 30% increase in the number of hospitalizations in the country in the last week, and a 32% increase in the number of ICU admissions in the country. In the last week, it was predicted that if Canadians do not lower the number of close contacts we see on a regular basis, the number of daily cases in the country could reach almost 20,000. The message is consistent. Dr. Tam of the Chief Public Health Office in the country said we should lower the number of close contacts. Yesterday, we announced that PEI's participation in the Atlantic bubble was suspended, effective at 12:01 this morning for a minimum of 2 weeks. This decision was taken as a preventative measure to further protect our province from importation of the virus and to protect our health system from being overwhelmed. We know the case counts are rising in other Atlantic provinces, and that Nova Scotia is experiencing community spread of COVID-19. New Brunswick continues to investigate their cases. There are 89 active cases in New Brunswick, 51 in Nova Scotia, and 23 in Newfoundland and Labrador. As I noted yesterday, COVID-19 may be around our province, and it is likely that PEI will have cases related to the public exposures and outbreaks currently underway elsewhere in Atlantic Canada. When cases are identified, we will continue to be diligent in our work to contain the virus through isolation and quarantine, testing, and contact tracing. I'd like to clarify a few points about what suspending the bubble means. Like so many aspects of COVID-19, planning and managing this pandemic is about balance. In deciding to suspend the bubble, it is about balancing the risk of importation and protecting the health of islanders with supporting the economy and minimizing societal disruption. We all would like our life on PEI to continue as normal as possible for as long as possible, despite being in the middle of a global pandemic. Given the incidence of COVID-19 in other provinces, non-essential travel to and from PEI is not recommended. Examples of essential travel include medical and dental appointments, court appearances, compassionate visitation, specialized animal care, shared child custody, and delivery of goods. Individuals who travel to PEI to work are able to continue to do so. They need to apply for pre-travel approval and will be automatically eligible to work isolate. We rely on these workers and their expertise to support service providers and island businesses. Our province is reliant on truck drivers to deliver food and other goods to transport island products to markets on the mainland. The work of the trucking sector is critical to our economy. Truck drivers who do day trips within Atlantic Canada returning to PEI at night will not have to self-isolate. Other truck drivers must register as rotational workers and will be eligible to work isolate. Islanders who return from travel off-island, including work, will be required to self-isolate. Those who must return to work can apply to work isolate. For example, islanders who travel off-island to fish in Nova Scotia and New Brunswick must self-isolate or work isolate when they return to PEI. Families with students studying at colleges and universities in Atlantic Canada can arrange to pick them up, and we will have clearer information on the website about how this can be done safely. We realize the timing of the changes and requirements related to travel within Atlantic Canada did not allow a long time for planning. With this in mind, for the next few days, screeners at all points of entry will have limited discretion to support workers who have not received approval for travel or work isolation. The need for all people traveling to PEI to self-isolate is not a new requirement. The measures announced yesterday are similar to the requirements that were in place in April, May, and June. And we have learned a great deal about border screening, pre-travel approval, self-isolation, operation isolation, and enforcement since this global pandemic began 8 months ago. I think we are now in a good position to operationally adjust our measures and guidance to support the 2-week suspension of the Atlantic bubble. We are working diligently to update our information online and in the community. And staff are also doing their best to respond to emails and calls from islanders in a timely manner. Masks became mandatory in public places in our province last Friday, November 20th. As I've indicated previously, a mask by itself is not sufficient to provide an adequate level of protection. It's one more layer of protection, and it's not our first line of defense. Compliance with other public health measures, hand hygiene, physical distancing, staying home when you're not feeling well, continue to be important tools to protect ourselves and others from COVID-19. Some individuals are unable to wear a mask for medical reasons. These reasons are not always visible to other people. So I urge islanders and business owners to not judge people who are not wearing a mask and to be kind and understanding when an individual indicates they are unable to wear a mask. Islanders have once again demonstrated their willingness to take steps to protect themselves and others by wearing a non-medical mask. Thank you to Islanders for choosing to do the right thing and wear a non-medical mask in public places. And thank you to Island businesses for doing their part to support the wearing of masks. The holiday season is a special time of year for most island families and a time when family and friends gather to spend time together. Many families and organizations have long-standing holiday traditions that include groups of people coming together. This year, we may have to find ways to reduce the risk of transmission of COVID-19 and look at holidays in a different way. It will not be like this forever. We hope it is just for this year. I urge Islanders to not travel off island this holiday season. During the upcoming holidays, please try to find other ways to connect with family and friends who live away. Family members who decide to travel to PEI over the holidays must seek pre-travel approval under the Family Connection stream and be prepared to self-isolate for 14 days when they arrive in PEI. Celebrating with people outside your immediate household brings additional risk. As much as possible, I urge Islanders to keep holiday gatherings as small as possible. If you plan to celebrate any aspect of the holidays outside your immediate household, please consider lower risk activities. And these may be some physically distant activities or even outdoor activities. This can be a stressful time for many people. Please take care of your mental health and look out for your friends and neighbors over the upcoming holidays. The Government of Canada has signed advance purchasing agreement for a number of COVID-19 vaccine candidates that are in clinical trials. PEI is working with federal and provincial partners to plan and prepare for the COVID-19 vaccines. We remain cautiously optimistic that a safe and effective vaccine will be available in the first quarter of 2021. There has not been a vaccine approved yet for use in Canada. The supply of vaccine will be very limited in the beginning, and there will not be enough for everyone to be immunized at once. PEI will be following the national recommendations regarding priority groups for immunization, and it's important to note that all Islanders benefit when our most vulnerable citizens are immunized for COVID-19. And we are committed to sharing what we know about the science of vaccinations to help Islanders make informed decisions about vaccinations. Knowing that some Islanders may be vaccinated for COVID-19 in early 2021 is like a beacon of hope for all of us. It signals at the finish line, although often the distance is in sight. I would like to note that this is really out of Nova Scotia, but anyone who either worked in a licensed establishment in the Halifax Regional Municipality or went to a bar or restaurant in Halifax Regional Municipality after 10 o'clock in the last 2 weeks should book a COVID-19 test, even if they don't have symptoms. And I mention that in case there are any Islanders who may have been in Halifax over those last 2 weeks after 10 o'clock at night in a licensed establishment. I know Islanders want to take all reasonable steps to protect themselves and others. Given the number of active cases across Canada, including Atlantic Canada, please pay extra careful attention to the following. Increase hand washing and surface disinfection, maintaining a physical distance from people outside your household, wear a mask in public places, keep your circle of contacts as small as possible, and if you develop symptoms of COVID-19, please go to a drop-in clinic to be tested and self-isolate until your test results come back. Stay home from work and other events when you are not feeling well. As this global pandemic evolves, it challenges us to be nimble and modify our provincial response. And I feel that together we are doing everything to try to protect each other and our community. And let us continue. PEI is in a unique position, and I hope it can continue. So let us, especially in these days ahead, please continue to be patient and kind. Thank you. And we'll open it up for questions.
Brian Higgins, CBC. Hello, Dr. Morrison. What does your department anticipate will be the most difficult or challenging aspect for islanders and for officials in terms of enforcing PEI's new regime in terms of not being part of the Atlantic bubble at this point?
Brian, I think it's a good question. I think we have been doing things like Operation Isolation and screening at the bridge for those outside Atlantic Canada over the last number of months. And so it's really to try to adjust to the increased numbers and make sure that people get into the system and that we can support them and follow them to try to minimize that potential importation of the virus and the spread of the virus in the province. And I know for the Office of Public Safety, trying to deal with the pre-approval travel requests that are going to be more than they were in the last couple of months. I think that's going to be an adjustment. And of course, we work closely with the enforcement colleagues in all of these areas. So, and I think trying to make sure that we get information out to all the different sectors and to the public about what these changes mean. I think that's not so much about enforcement, because I think people really want to do everything they can to protect this island and our community.
Parents going to pick up university students are given a 24-hour grace period to make the trip there and back without self-isolating. Does that not leave open the opportunity of a gap in protection there, in which they'll be riding in a car in an enclosed space with someone who is potentially COVID positive? And as we've seen, that is the way that actual COVID case did in fact arrive on PEI in the past.
So, I mean, I don't, in terms of the last part, I'm not sure exactly the details of what you're referring to there, but the advice, if you were going over to pick up someone for a medical appointment, for instance, or pick up a student, and you were going over and back, you're minimizing your contact, you're trying to fill up your car with gas here. We don't want people stopping and having a meal somewhere. And we'd like that person, if they're picking someone else up, whether it's medical appointment or picking up a family member from university, they need to sit in the back seat. Both people wear masks, furthest distance away from each other. We know that kind of thing does happen already in terms of transportation. If you were on a bus, for instance, or a taxi, and those are measures that are put in place. So it's, again, if it's only done if you have to do it, and that would be one of the essential reasons to do so. But it's trying to balance that risk. And of course, if someone does pick up a student, the student, when they do get back, they need to isolate for 14 days. And then the parent, usually who's gone over to pick them up, would need to be very conscious of all the other measures we talk about every day: masking, physical distancing, and monitoring for symptoms.
Thanks.
Gabrielle Fremont, Radio-Canada. Gabrielle Fremont, Radio-Canada.
Alors bonjour, bonjour à vous deux. J'ai une question en français pour la docteure Heather Morrison. Alors, docteur Morrison, vous avez récemment mis en place une clinique temporaire de dépistage à Lennox Island. Alors, je voulais savoir pourquoi avez-vous mis en place cette clinique temporaire pour faire des tests dans cette réserve autochtone? Est-ce que vous avez remarqué s'il y avait un besoin? Est-ce qu'il y avait des soucis par rapport à une éclosion dans cette réserve? Et quelles sont les informations que vous pouvez nous donner concernant les résultats et ce qui va se passer dans les prochains jours?
Bonjour Gabrielle. À Lennox Island, on a mis augmenter la capacité de faire les tests là-bas parce que c'était vraiment précaution. d'en faire parce qu'on voulait que les gens étaient, c'est possible, dans cette communauté, il y avait quelqu'un qui était supposé d'être en isolement et puis ils n'étaient pas en isolement, alors on voulait s'assurer que si on pouvait faire plus de tests dans cette communauté, on a eu la chance. Mais il n'y avait pas un cas positif là-bas. C'était vraiment une autre mesure pour cette communauté.
Parfait. Et je voulais vous poser la question que je vous ai posée hier, mais je n'ai pas eu à obtenir votre réponse. C'est au sujet du vaccin, justement. Comment avez-vous qu'Ottawa fasse la distribution des vaccins contre la COVID-19 ici à Lille? Est-ce que ça va être en fonction de la population, des cas actifs? Comment vous voyez ça?
Ici, à l'île du Prince-Édouard, on parle beaucoup avec nos partenaires au gouvernement fédéral. Et à ce moment, c'est le nombre de vaccins pour chaque province est vraiment par population. Alors, la population est 0,42% pour la population de l'île du Prince-Édouard. Alors, on pense que c'est cet nombre de vaccins qu'on va recevoir quand on a s'il y a un nombre qui arrive au Canada, on reçoit ce montant ici à l'île du Prince-Édouard. On est assez chanceux vraiment c'est pas une grande province comme Québec, Ontario, les autres. Alors, serait plus facile dans une façon de distribuer le vaccin, mais ça va être vraiment les quantités limitées qui arrivent en des montants qui commencent, j'espère, en janvier, mais en de petits montants, janvier, février, mars. Mais j'espère que le fin de 2021, tous les insulaires qui veulent être vaccinés, c'est possible.
Okay, parfait. Merci beaucoup. Bonne journée.
Bonne journée.
Louise Martin, CBC.
Oh, hi. Thanks to you both for taking our questions today. Dr. Morrison, I just wanted to follow up on what you started to say about holiday gatherings and asking Islanders to keep their gatherings small, as you've said before. I know Dr. Tam was a bit more urgent in her message to keep holiday gatherings to just their household. So are you asking Islanders to limit their holiday gatherings to just their household?
Louise, we're having that discussion earlier today. I mean, I think, and I've heard Dr. Tam say that about the household, and I think we really need to see what happens in the next couple of weeks. So that advice may be what we need to say here in PEI, but one of the reasons we put these border measures in place is to see what happens here in this province over the next couple of weeks. So I think certainly keeping our contacts small and as small as possible is really important. And we may need to say household only, but I don't think we need to at this point in time in this province yet.
Okay, thank you. And just before I get to my follow-up, was there anything in French that you need to translate for us that we may have missed? My apologies.
No, I was just I made a little note that I have to go back and translate. It was really about the vaccine and how the sort of numbers that we would expect here. And I think we're in close discussions with our federal partners about the vaccine, and when vaccine is approved in this country and arrives in the country, it will be distributed to all provinces and territories on a per population capita basis. And so I think that will certainly be part of what happens here, and it will be in small quantities that'll start hopefully in early 2021, and that will continue in small quantities over the months ahead. And really, any Islander who will want to be vaccinated, I hope in 2021 will have that opportunity to be vaccinated, but following the national recommendations around certain priority groups, and we're having lots of discussions about that. We would be following some of those national recommendations to try to protect everyone, as well as the vulnerable groups, early as the vaccine arrives.
I think the health minister mentioned a number in the legislature. Was that accurate then, the number that he had said? I think it was 20,000 initially.
I think it's difficult to know exactly how many doses of vaccine will come, because those numbers have not been confirmed yet, and the vaccine hasn't even been approved yet in the country. And I think any number that is calculated based on those initial first track vaccines that are expected, the Pfizer, Moderna products, would only a certain number would come in January, and a certain number would come in February and March. So we are trying to make sure that our providers and the minister and the public certainly know the numbers as soon as we do, but those numbers were probably based on the per population calculations of what has been out in the media.
Oh, okay. And I'll quickly add my follow-up. Just I got off track there, but I just wanted to clarify the rules around children returning from the provinces. And I know they can continue to go to school, not attend functions though, like sporting events. Hockey PEI said 2-week period ending on November 30th. The public school branch says 14 days from the date of return. Can you just clarify what exactly you're asking? Is it 14 days from date of return, or is there some sort of ending period on November 30th, which Hockey PEI seemed to indicate in an email to parents?
Hi, Louise. I didn't see that particular email. Certainly, I think the direction yesterday was 14 days from the return from our Atlantic provinces. So if you came back, a week ago, it's really to make sure that you are doing enhanced measures for a period of 14 days when you arrive back in the province. So that if there's different dates being circulated out there, we can help clarify.
Appreciate that. Thank you so much.
Welcome.
Julien Lecacheur, Radio-Canada.
Oui, bonjour, Dr Morrison. Dites-moi, Dr Morrison, je voudrais revenir sur le cas que vous avez annoncé hier de cette dame âgée dans la quarantaine et qui a assisté à des funérailles au salon funéraire de Central Queens. C'était jeudi de la semaine dernière. Dr Morrison, tout d'abord, pouvez-vous me confirmer que cette personne est bien arrivée depuis l'international, depuis l'extérieur du Canada, qu'elle a été testée négative avant d'assister aux funérailles et qu'elle a été testée positive après les funérailles auxquelles elle a assisté jeudi dernier?
Bonjour. Vous êtes. C'est vrai, on a annoncé un cas hier. C'est une dame qui est en quarantaine. Mais je sais qu'ici, à l'île du Prince-Édouard en particulier, je sais que c'est quelque chose que vous savez que. Je ne peux pas parler à propos de beaucoup plus de détails. Parce qu'on veut protéger l'individu et je sais que au funérailles, c'est quelque chose, ils m'ont parlé et puis c'est vraiment, tout le monde est coopératif et il veut protéger, c'est vraiment une précaution c'est pas, on dit pas plus que ça à ce moment et puis c'est vraiment, il y en a beaucoup de personnes qui ont déjà été testées et puis sont négatives et c'est vraiment une précaution.
Docteur Morrison, quelles sont les règles pour les personnes qui arrivent de l'extérieur de la province et qui souhaitent assister à des funérailles? Est-ce qu'ils doivent appliquer pour un papier, un document? Est-ce qu'ils doivent s'isoler? Est-ce que vous pouvez me parler de la procédure?
Si quelqu'un arrive maintenant hors de la province et avant ça, c'était hors de la boule atlantique qui veut arriver à l'île du Prince-Édouard pour les raisons compassion. Il faut faire application. Et puis, je sais qu'on a des cas, des fois, c'est pour les raisons d'aller à l'hôpital, pour voir quelqu'un qui est très malade. Des fois, c'est pour voir quelqu'un qui est très, très malade à la maison. Et puis, c'est des fois pour les funérailles. Et et l'information est que c'est comme pour un funérail de la famille ou privé où vous pouvez porter un masque et garder la distance. Mais c'est pas, vous n'êtes pas supposé de aller à, je ne sais pas comment vous dites en français, un wake, c'est pour les funérailles. Et puis, on est en train de regarder les directions et on a les directions et on travaille assez, on a beaucoup de communication avec les directeurs pour les funérailles et on va continuer ces discussions.
Merci beaucoup.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'avais une question pour au sujet des masques qui sont obligatoires dans les espaces publics intérieurs. Est-ce que quand on va au bureau pour travailler, est-ce que quand on est assis à son bureau, on peut enlever le masque? Est-ce que c'est juste dans les couloirs qu'il faut le mettre? Comment ça se passe pour le travail, s'il vous plaît?
Bonjour. Oui, les masques obligatoires pour les personnes qui vont au bureau et c'est pas quelque place où on voit la public et c'est pour moi je mets la masque avant de monter ici au bureau et quand je suis dans mon bureau il y en a personne autour de moi je peux enlever ma masque mais si je sors pour chercher quelque chose à manger ici, je mets mon masque. Alors, je pense que c'est la majorité des bureaux, si on pas beaucoup de personnes de la public qui sont au bureau. Je pense que ça, c'est qu'est-ce qu'ils font, mais ça dépend du business.
OK. Et j'avais aussi juste une question sur les vaccins. Vous avez mentionné que ce sera le gouvernement fédéral qui va mettre en place, qui achète les vaccins. Il y a eu plusieurs nouvelles de différents laboratoires et ces vaccins sont très différents. Il y en a certains qui doivent être stockés très froids, d'autres qui peuvent être stockés plus facilement. Est-ce qu'on aura plusieurs vaccins ou est-ce qu'au final, il n'y en aura qu'un seul qui sera choisi?
C'est une bonne question. On va avoir plusieurs vaccins. Il y en a les vaccins, on les dit les first track, les vaccins qu'on anticipe d'arriver ici à l'île du Prince-Édouard en premier, sont les vaccins qui est gardé à peu près à moins 75 degrés et l'autre à moins 20. Et puis on va avoir d'autres. Et puis les indications pour ces vaccins vont être confirmées avec Santé Canada quand ils sont approuvés ici au Canada.
Merci. Bonne journée.
Bonne journée.
François Leblanc, Radio-Canada.
Oui, bonjour, Dr Morrison. J'aurais une question au sujet de tout l'imbroglio qui s'est passé entre le fait que, semble-t-il, vous aviez donné une permission à la Ligue de hockey junior majeure du Québec et aux Islanders de Charlottetown de pouvoir disputer des matchs, même si vous fermiez ou l'île du Prince-Édouard se retirait de la bulle atlantique. Et là, en soirée, ça a changé. Pourriez-vous m'expliquer pourquoi la santé publique de l'île a retiré cette permission? Est-ce que ça avait même été donné? Peut-être nous rappeler un peu les faits aussi.
I'll also answer it in English and French because I think there will be some questions about this in both languages. Alors, c'était vraiment, c'était une discussion qu'on a compris que les joueurs et l'équipe pouvaient pas vraiment isoler comme il faut. Si voyager, c'est important qui fait ça et puis il doit voyager pour faire les matchs. Alors, on a juste en parlé avec le gouvernement et l'équipe, le franchise. Et puis, à ce moment, c'est suspendu. Il ne peut pas jouer ici. Et puis, même chose pour les autres sports interprovinciaux, n'importe quel. Et on ne fait pas ça ici. Et puis, ils ne peuvent pas vraiment voyager parce qu'ils ont... il ne peut pas isoler comme il faut en retournant ici à Lille.
Mais pourquoi vous leur aviez donné la permission au départ, après ça leur a été retiré? C'est là que je pense que les gens se posent beaucoup de questions.
Je pense pas que c'était... Je pense que c'était pas vraiment un cas où on a donné permission et on a changé notre avis, que c'était juste quelque chose que, quand c'était plus clair qu'il ne pouvait pas être vraiment... pouvait pas isoler et puis peut-être il pensait qu'il pouvait en premier, mais c'est devenu assez clair assez vite que c'était pas le cas. Et alors c'est la meilleure chose d'en faire. On suspend la boule atlantique pour nous ici à l'île du Prince-Édouard et on peut faire la même chose pour ce franchise de hockey. That question I know has been asked a few times in the last since last night. It was about the Islanders hockey, and the question was really about, did we give permission and change that permission? And right now the Islanders hockey team is not going to play any games, from my understanding, in Prince Edward Island, and will not be traveling off island to play other games. And it was really, they are not able to isolate upon their return, and so that really is not a possibility for them. And we are not having interprovincial sport over the next 2 weeks here in this province. And so that was a decision that once we had a good discussion back and forth with the Islanders, I think that was, it just became clear.
Alison Jenkins, The Guardian.
Yes, good morning. Wanted to follow up. Actually, first off, before I get to my questions, wanted to ask if you could repeat the answer to the question about the clinic on Lennox Island and about the latest case and relation to the funeral home, and about several vaccines. We'll be getting several vaccines, and just sort of why.
Okay. So I was asked about some extra testing that was done at Lennox Island, and that was a clinic set up a number of days ago, and it was not related to a positive case, but making sure that those in the community had access to testing because of a concern of someone who had not isolated. And that had come in from outside the Atlantic bubble, and so we were just out of an abundance of caution, wanted to give that community a chance to have some additional testing. And in terms of the funeral, I think it was the funeral home, and I answered that question with media earlier this morning as well, that again, out of an abundance of caution, there was a release yesterday of a potential exposure not at a nursing home, but at a funeral home, at the funeral home on Thursday from 4 to 7. And again, just advising anyone who has symptoms that they should be tested. And we know a number of people were actually tested yesterday and have tested negative. So again, just trying to be careful wherever we can. And the third question I think you had there was around vaccines, and that we would receive likely in Prince Edward Island not just one vaccine, but a number of vaccines over the course of the next number of months. So as I mentioned, none of them have been approved yet in Canada, but we anticipate a couple of earlier vaccines that will hopefully be approved and start arriving here in January, February, March. But there will be different vaccines. There'll be one product that may need to be stored at -75, another product stored at -20. The other thing is that, and I don't think I mentioned this in French, but these vaccines are almost all 2-dose vaccines that are anticipated. So it would mean you would have one dose, and then 21 days later for one vaccine you might have a second dose, and then the next vaccine, the second dose might be at 28 days. So there are certainly some logistical things to consider as this vaccine rollout happens in the new year.
And just to follow up on the funeral home, I believe the question the Francophone reporter asked was regarding, is this funeral home or potential exposure related to the woman, the latest case, the woman over 40 who returned from outside the bubble?
So, and sort of what I tried to say as well, that, you know, in Prince Edward Island, without a lot of cases, we are certainly trying to I'm unable to talk about a lot of details about individual cases, and I think that's important. But the funeral home, in this case, has been very cooperative. It has been the whole community has been very cooperative, and it is out of an abundance of caution that there could have been an exposure at that facility.
Okay, that still doesn't quite answer my question, but I'll move on. And I wanted to ask, you had mentioned taking care of your mental health. That's going to be perhaps a little harder than usual. There's no psychiatric urgent care clinic in Charlottetown. Will that be coming back online, you know, as a stressful holiday season and further shutdowns sort of are coming up?
I'm going to just ask Marion to answer the question.
Sure. Yeah, good morning. We've been working with the mental health and addictions team on their plans, and as people recall, the Psychiatric Urgent Care Center was something that we shifted our resources to from one of our inpatient care settings for mental health patients. So we're using our same staff and redeploying them to another area. So as we've reestablished our former services, that has put a strain on adding any new services, which the Psychiatric Urgent Care Centers were part of those new initiatives. And they were quite positively received and welcomed by individuals seeking that type of care. So that team is working on how they can reestablish that clinic with both staff and psychiatrists to support the patients there. But we have been looking at what all the alternatives are for any age group of individual really seeking care. And so there are many services still available, and lots of virtual appointments as well, and other things for anyone who might be feeling strained through this self-isolation period and that kind of thing, where they're worried about seeking access to care. We would encourage people to look online for the mental health services that are available, including virtual appointments, which are available every day to individuals. So we just ask people to continue to seek care if they need it.
And where
Thank you.
are the best places to seek care?
That's all.
I think that's it. So thank you very much. Thank you all.